Dr. Patel, I know sometimes when we tick through those numbers are potentially missing context. So what more do you want our viewers, our listeners to understand about those numbers and where we are in this moment?
Yeah, Alicia, I think a very important kind of feature for those numbers is that, number one, not only are the cases going up, we are starting to see hospitalizations going up, starting in New York City. I'm in the DC area. We're starting to see it. It is certainly nowhere near what we saw with Omicron, but we don't want to wait till that happens. And then on top of that, deaths had been coming down. They're still very low, about 300 deaths a day, but we're also starting to see that plateau a bit, Alicia. That tells me that the next weeks, those numbers are likely going to continue to go up. And then the other thing that I'll tell you that we should just reinforce is that only half of the Americans that have been fully vaccinated that are eligible for a booster have gotten them. So we know that some of the difference, Omicron, the difference with not going to the hospital or going to the hospital, a lot of it had to do with whether you were vaccinated, including that booster. And then we know with children 5 to 11, only 28% are fully vaccinated. So those numbers need to come up, or that leaves people susceptible, even if previously infected, to new infections.
I want to come back to that question about kids getting the booster shot with you in a minute. Omicron has been changing what we thought we knew about COVID, specifically the incubation period for Omicron said to be between 2 to 4 days, shorter than other variants. How does that impact then how often, when people should consider testing?
Yeah, great question. So look, I have been telling people that you can start testing even 24 to 36 hours after a suspected contact. So you do not need to wait. We used to tell people, wait 3 to 5 days. You don't need to do that. Home antigen tests can be incredible assets to have. Alicia, I recommend them. The government will give them to you for free. But if you have symptoms and you have a negative antigen test, I would still get that PCR because I'm seeing a lot of false negatives, even with proven COVID on PCR. But I would recommend people start testing if you have the test at home, 1 to 2 days after a probable contact. We're seeing them flip positive pretty soon.
We've talked about boosters. We've talked about testing. I also want to talk to you about mask wearing because you have the CDC recommending that people in about a third of counties start masking again indoors. What do people need to know? Because this is a calculus, again, everybody is doing over and over day after day.
It is. I do think that if you're going into an indoor space and you just are crowded in, that can be a restaurant, it can be wherever you fill in the blank, airport. I would put on a mask, especially in many of the areas across the country where we're watching numbers coming up in double digits. And I just want to say this because I know people are tired, but think of what happens if you do have a positive, even if you are fully vaccinated and boosted, such as myself. That means at least 5 days of isolation, 5 days where you cannot do your job if you need to, 5 days where you have to have other loved ones away from you. So the disruption to your life, in my opinion, is not worth it as cases go up. And this is such a highly transmissible variant. It's not just the Omicron of December and January. It's even more infectious, so that much easier to get. So it just makes sense. Crowded spaces indoors, put a mask on.
I've got about 30 seconds left. I'm going to ask you, Dr. Patel, to put on your public health hat and just talk to me more broadly about the moment that we find ourselves in. I mean, the reason I read that polling is because there are a lot of people who've moved on, or they think they've moved on, or they want to move on. And there is the reality that you laid out, which is we are still very much in this. How do you communicate around that? How do you build policy around that when you have those two competing truths?
Number one, simple acknowledgement and honesty that we're all tired of this, but I think also showing people that we are making such progress. This is so different than March of 2020. So I do want to emphasize we have treatments on board. We have these vaccines that are incredible on board. It's just a matter of all of us doing it. We can get more people boosted, Alicia. This would be a very different conversation. We can strive to get to that goal as public health officials.